they've had for many, many years. They're in limbo. What do they do now? Try searching for another plan? Look, these are the details. This is what's happened. Now, these patients, they're in limbo.
350,000 doctors.
Yes, that's in the program.
Right.
We don't know how many thousand have been dropped, okay? Right. But thousands have been dropped. What about their patients? What about the people who used to have this doctor who now no longer have this doctor? Broken promise.
And a lot, many of those people are women who are expecting babies and who have a real relationship with their physician and want to see the same doctor deliver possibly their second child. And they are now left in the dark at a time that they're feeling quite vulnerable.
Most of them are elderly. And how do they go about keeping the doctor that they've had for many, many years?
Well,
what do they do now?
Yeah, because earlier before, in the commercial, we were talking about next year when the employer mandate comes out, right. Look for, and Elizabeth, to your point, a lot of families who have the family doctor they've loved forever. There's a real good possibility that millions of Americans will lose their doctor next year.
Yes,
the employer mandate.
That is correct.
So Medicare Advantage is supplemental insurance.
Correct.
So why would the doctors be affected by supplemental insurance? It's not part of Obamacare.
The federal government pays the insurers a per-patient fee to take care of Medicare Advantage customers, okay? That payment is being cut by $150 billion under Obamacare.
So can I take it one step further?
Yes, that's correct.
And we saw this coming. We talked about Medicare. Yes. People who are on Medicare Advantage might start to lose their doctor, might start to lose their insurance. Now, let me be conspiratorial. AARP says they have a competitor to Medicare Advantage. Are people going to be forced to look at AARP and those types of companies to supplement their insurance going forward?
They are going to be forced to look elsewhere because United Healthcare is dropping these thousands of doctors, pushing hundreds of thousands of patients out of their system of coverage. They've got to look elsewhere. They are essentially in limbo. But just 1 second now. You follow this down the road. There's $150 billion cut from the Medicare Advantage program, right? Now, supposing the president wants to fix this and reinstate the $150 billion. Where does that money come from?
Oh, we know.
You've broken another promise.
We know where the money's going to come from.
It is going to add a dime to the deficit, unlike the promise that the president made. That's 3 broken promises. Here it comes.
Very costly.
And it's Monday morning, and as you introduced me, have a nice day.
Thanks, Stuart.
I'm sorry about this.
All right, Cyril, this is